Hello, everyone. This is Dr. Mike Chua, physical therapist. Hey, today we're going to be talking about answer some of the questions that some of our clients have been asking me on how do you get to expand your business and everything. Okay, we'll be back in a few seconds.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
All right, I guess we are back. If you're watching live, comment live. Watching on a replay, comment replay. Well, I feel like I haven't been going live lately, but I think our streaming is not that the best right now. Anyway, let me answer some of our questions in our alternative career group. I get a lot of private messages and emails, so let's go ahead and dive into all these questions and answer them as much as I can. Right? First questions that the first question, first questions that we receive is how do you get into and expand your business and facility? This is a great question. Let me go up to my answer. I'll post my answer too. So, right. Start by building relationship with the owners, the facility owners, the administrators, the staff. Attend their community events, offer free workshop. In service, explain how your services could benefit the patients. What I did before, I offered free group exercises. I offered like what I said, workshops and everything. So go in there, offer, providing services without asking anything in return first, right? So do that. Next question is, do you have a marketer or have a marketer or use media? It really depends on your resources. Initially, you might market yourself. What I did initially is I did everything. I did podcasts. I interviewed them like this. I think podcasting, interviewing like this is a much better way because you get to know the doctor, you get to know the people there, and they get to know, like you, and trust you. So now I have like a lady who goes out and markets for us, and of course I use social media, Facebook ads, right? So I think we spend like $1,000, so $1,500 a month. So for that, okay. Next question is, do you have a contract with facilities and pay them in any way, like rent exercise room, or a monthly fee? That's a great question. Some we have it for free, some, we rent. So it just really depends on, again, on the relationship that you had. On assisted living, you don't really have to rent because you're doing the exercises in the home. That's basically their home. You're changing the place of service to home instead of office. And of course, if it's an office that you've credentialed that space, that will be an office space, right? So no, well, we don't do percentage sharing. That's a no. So yeah. Next question would be, who is teaching exercise, fun, and activity classes to residents in your facility? Is it you, or do you hire someone specifically for this? I used to do it personally myself when I was by myself. I did everything. Most facilities, they have their activity director, but of course they're overwhelmed. They do a lot of stuff. So if you offer your free exercises, group exercise, that'll be a lesser burden for them. So I did it before myself. Now we have someone who's doing it for me. All right. The next question: do you advertise to independent living communities? If so, yes. The people that the facilities that we go to, most are independent living facilities. Again, offer uh, group exercises. Whatever thing you can offer. Education. What I did before too is I connected them with different physicians and local nurse practitioners in PA, and I would send those PAs and NPs to do an educational talk, pharmacist, and everything. So you can do that too. So now you become the resource person or the go-to person, right? Next, is how did you build your amazing team and find clinicians to work for you? You actually attract people. You attract people according to how you project yourself. So I don't attract people who are sports oriented. I mainly attract what you call this geriatric therapist who wants to take care of geriatric patients. Of course, now we have a pediatric contract, so through the state, now I am attracting pediatric therapist who wants to serve pediatric cases. So you build that by creating your own niche. So you find that specific niche, and other therapists will gravitate towards you. You can't be just a generalist, right? Okay. What platforms? I'm running out of English. What platforms are strategies do you use for recruiting? Of course, I use Indeed. I don't even use other what you call this other websites, but I do have the Indeed. I post an ad there. I don't even pay for it. It's just the free one. I have Facebook groups. Um, APT career. I just asked the local APTA email. Hey, could you send it? I don't post because it's incentive. And referral bonus. You can also do referral bonuses, but I don't have that in our thing. So if you are paying someone to join you, they're probably going to come in and look at that money. I don't pay a lot. I'm an outpatient clinic. I cannot match big companies, big outpatient clinic rates because we do one-on-one. We don't do groups. I'm not a nursing home. We're not a home health agency, so I really can't pay. So people who come to me, I can tell now, we don't pay them a lot. They just come in because they just want to serve, a one-on-one treatment and take care of our patients. So, right. Same question. Do you have a dedicated marketer for recruitment or promotion? Actually, no. I initially did it myself, and we have like two people who does this for us in our clinic. It's not a full-time position. When they're not going out, they are at the clinic, doing tech jobs. So yeah. Next is how did you transition from mobile to office practice, or do you use both models concurrently? Yes, we do both. We do both. So I started with doing home visits, mobile therapy, and then we went to the assisted living, and then we grew there, and then we still have those locations, and then we opened up our first location, our brick and mortar. As of right now, as of this recording, we have like 8 locations now, and both a combination of brick and mortar, inside daycares, inside the adult daycares and retirement homes. So yeah, you can do both. You can do one or two or three or whatever you want to do, right? All right, next question. Are you credentialed with commercial insurance or Medicare only? Yeah, this really depends on your goal. You can't grow just by seeing Medicare only patients. If you want to grow and scale, you have to also accept other insurances. If you're just a single practitioner, yeah, you can nitpick. Yeah, okay, I'm just going to accept Medicare only. But if you are trying to grow and serve more and be more and do more, not just for your community, but also for your staff, you have to learn how to accept other insurances. So that's what I have. That's what we have. Yes, some have a crappy reimbursement like $30, reimbursement $40, but we see them for a 30-minute visit. So yeah, yes, accept them. Okay. And yes, we also offer packages for cash paying patients. We are trying to onboard a therapist who is dry needle certified. We can definitely charge cash for there, but right now our most of our cash are mainly for the group exercises where they come in 2 times a week as a group, and they've been discharged from therapy and they just want to keep on coming and joining the group exercise. Okay. What is your main referral source for your practice? Really, it's to be honest, it's really word of mouth. Word of mouth, and of course, we now that the patient enjoys coming into our clinic, they would go back to their doctor and they would say, "Hey, I want to go back to that therapy clinic. Jerry have physical therapy." What I would also do is talk to physicians and nurse practitioners in the area, and just be really, a servant attitude, servant heart. What we can help them with. So that's what we do. But really, it's just word of mouth. How do you handle referrals and communication with facilities, physicians, POAs, and family? Um, I personally, reach out to the patients too, but we have a front desk coordinator, we have a patient admissions coordinator, uh, you know, uh, we have virtual assistants who would call and follow up with their signed plan of care, thank them for their referrals, call the patients and everything. Not just our front desk, we have a remote team who does that. On that same note, we are eventually going to offer that service to the people who are wanting to grow their side hustle or this business. So if you need virtual assistance, we will provide that eventually. All right. Next, how do you explain the need for physical therapy for specific patient? You just show them what you do. It's a very tricky question. How do you just show them what you were really made of? You can you sell physical therapy by selling yourself. How about that? All right. If you are a, I'm sure you are, whoever asked these questions, I'm sure you are an amazing therapist, but there are a lot of therapists out there who does a crappy job. Same thing with physicians and nurses or other, say mechanic. You can be the most knowledgeable person, but if you don't have a good bedside manner, that patient will not come back. So same thing, the need for physical therapy. We see patients who are in hospice. We see patients in the assisted living. We see patients in our clinic. They intentionally go, put on their makeup, put on their clothes, and drive intentionally to go to our clinic, and because they see the value. If they don't see the value on it, they're not going to go to you. They're not even going to call you and set up an appointment. So provide so much value in your skills, in your profession, in your current patients. In that way, they will see the need, not just the need, the want. They just want to go to you. Our problem now in our clinics is that we are so overbooked that they just show up whenever they want to. And I said, we will say, no, you don't have any appointment today, which is a happy problem, right? But yeah, okay. Um, Next questions. How do you make your practice well known with your community while focusing on specific counties? You know what? That's a great question. You just become so, what you call this, popular. What's that? How you say? Be so popular in your area. Create podcasts like this, interview people, serve people, interview your own patients. That's what I did before when I had the time. I would interview my clients, of course, with proper release, video release form and everything. I would interview them not because I want them to promote our company. I just interview them just because I wanted to know them, get to know them, who they are, and everything. Okay. Next question is, have you tried? Where did that go? Have you tried or found success with activities such as joining local business group, blogging, contracting with providers, and everything? All right. So yeah, I mean, you can do local business group. Obviously, that's not my target audience. My target audience is seniors, geriatrics. So that's really not. But you can, if those are your target audience, why not? But I've stopped paying, membership for, the business group because they're not really my target audience. More like a vanity tag for our clinic, right? Blogging, yeah, I guess, yeah, it's fine. But I mean, people watch. Do you still read blogs? No, I mean, people watch videos now. And the value that you provide. Next is contracting with providers. Yes, we used to have contracts with different home health agencies and other agencies, but it's good when you're starting. But as you grow that business, It's harder and harder. So we recently terminated our contract with another home health agency because I just can't provide care for their patients anymore, because I would rather take care of our own patient than taking care of their patients. But when you're starting up, it's fine. You can do that to grow your caseload. But as you grow and develop more patients for your own clinics or your own practice, you will eventually have to let go of those contracts too. It's good to start, when you're starting. Okay. And then, last but not the least, can we coordinate a visit with you in March? Yeah, you just send me a message, and then we'll go out and eat lunch. You can observe me and join me. And speaking of that, we do have a program that I'm launching, or it's not really a very robust program. Basically, you work for me for like 13 weeks. I pay you, of course, for your reasonable rate for our area. You work, see patients for me, and on the days or on the times that you're slow, ask me those questions. Imagine 13 weeks being with me, asking all these questions and learning from me. If you already have your business up, that's good. We don't have to worry about your LLCs, DBA, EIN, business checking account, and everything. But if not, if you don't have those, we will start everything from scratch. Of course, with you're going to have to pay for that, not me, right? But imagine working for someone else and teaching all the ins and outs of our business. It's not perfect. Nobody's perfect. I'm not perfect. Our business is not. But if you learn a thing or two working for me for 13 weeks, and then going back to where you're at, what city or state, you can definitely take this knowledge and everything. You can even probably use Jerry Hab on your area if you prefer to. All right. Again, thank you very much. Be awesome, be great, be excellent. I'll see you in the next episode of our anonymous post. Bye bye.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.